Hello, good morning to you. Many thanks for joining us. You're watching Galaxy Today, coming to you from Galaxy Television. It's the first edition for this week. We trust you had yourself a wonderful and rested weekend like I did. And welcome on board. My name is Justin Akadonye.
And no doubt he's on with Uche Onyegoriji. Like you rightly said, we had a very restful weekend. And it's really good that we start up the week in a very interesting way. For the ladies, I'm sure you want to be part of this show because today, okay, let me say the very first 30 minutes is focusing on you. Okay, like Justin rightly said, it's the very first edition for this week and I'm almost excited because today we're going to be learning a lot. And to be part of this program, all you need to do is send an SMS to the numbers that will be written on the screen. And this SMS could be your comments or questions or whatsoever thing you want to say, but hey, make sure you do not call. And also, you can also use our social media platforms using hashtag Galaxy Today. Let me allow Justin to do the introduction of who we have.
All right, we have a very beautiful guest who will be discussing fertility, infertility issues. Specifically, we'll be focusing on the women on the first half of the show. But for the second part, we have another guest who is standing by. Why do you think men most often struggle with their relationship with their children? You know, we need to find out, is it that men are not natural caregivers, or what exactly are the issues? We have coach,
feel strong.
You said?
Like Justin.
No,
you want to feel strong. When you know you're actually eating up. I mean, why wouldn't you want to relate with that child? Or
I relate well with
children. Be like, please,
Justin. I really, I'm very fond of, and but it is an issue. I'll be looking at it on the men's segment.
Being fond of is not having a relationship.
Coach, leave me alone on the Monday morning. So, Coach Deji is in the house, and he'll be discussing that. But before we look at that, let us talk about something that's really pertinent. That has been causing issues in most families. And that's the issue of fertility, infertility, if you like, and. What is it that we need to do to improve on our fertility? We'll be looking at that on the show this morning. And we have a guest in the house. She is a medical doctor, a health and wellness expert, a fertility health coach. Ladies and gentlemen, let us make welcome Dr. Nini Izoba. Many thanks for joining us on Galaxy Television.
Thank you so much for having me.
I hope I pronounced your surname right.
Yes, you did actually. You did. Thank you for having me.
It's good to have you.
Thanks, Uche. How are you?
Okay, I'm good. That's good. I have a whole lot of questions burning in my mind, and I'm just wondering which to start with. Okay, so let's start with fertility. What exactly, when you talk about a female's reproductive system, what exactly does that mean?
So your reproductive organs or your reproductive system consists of the organs in your body that are responsible for having babies, basically. Okay. So they're different for men and different for women. So that's your reproductive organs, basically. Anything in your body that is actively involved in baby making and conception and all of that. So that includes your ovaries, your fallopian tubes, your uterus, womb. For the men, includes the penis, just your reproductive organs.
Okay. But why is it that most often than not, specifically in this part of the world, when couple have issues conceiving for a while, it is often blamed on the woman? Why is it the case?
It's really, really bad. Just like Uche said now, specifically for the women, when you're introducing, it's a mistake that we all make, and it's something that we need to correct because it just delays the finding of the solution, basically. When we talk about fertility health, it's not just directed at women, People have to know that when it comes to infertility, there's, 33%, of the causes is due to female infertility, 33% is due to male infertility, while the other 33% is due to a combined causes. So it's something that we need to change. You're very right about that. Males or men are not excluded when it comes to dealing with fertility, and that's something that we need to push out there so that more people or more couples know that when women are going to the hospital, drag your husband along, There's nothing wrong with that, but men are always, so macho. They don't want to. They're like, no.
Always trying to be too busy, to have time for things that matter. Most times they make excuses of being too busy to have time for family.
Yeah. But that's actually one of the most important things, especially because if you know that, this is something you guys want, I feel like it's something that both males and females should go for regular checkups for, and there's nothing wrong in doing that.
Okay.
Okay. I see. Okay, so when we talk about fertility, a whole lot of people think, I mean, back in the day, they used to think when you live a wayward life, it can lead to infertility. But we've seen in recent cases that you don't even have to be wayward.
We have virgins that,
So, someone, I like to say it again, I used to say it all the time. A lot of people say it is when we started embracing the Western culture, we started having Western issues, you know.
Right.
So would you say that the cause of probably delayed in pregnancy or infertility could be an attribute of what we eat, or could it be a lifestyle? Or what exactly would you say is the major cause for infertility?
Like you said, I'm glad you mentioned that. There's a lot of people that used to think, oh, if you can't have a baby, that means you've done series of abortions, and and I need to correct that notion. We have virgins out here that can't have a baby, and this is because there are some medical causes that lead to infertility, just like PCOS, endometriosis, fibroids, so many things.
You're mentioning terms. PCOS, break it down to our viewers.
PCOS is just basically polycystic ovarian syndrome.
Okay.
So basically you have multiple cysts in your ovaries, and it causes hormonal balance and ovulation disorders. And when you have that, you're not able to
What could be the cause of the cysts?
That's the thing. When it comes to reproductive health, most of the causes are really unknown, or it just happens. So what we need to do is just know that they're common, and when you do have it, and most times you won't have any symptoms, so that's why regular checkups with your OBGYN is very important. And like you said, Western culture or Western diet, civilization has a lot to do with it, because if you remember back in the days, people just once your mother is of age, once she turns 18 or 19, she's given, she's already married or probably had children, just like my mom, You tend to get married at an earlier age than now. But now women are, we're more career driven. You see women in their 30s, early 40s, they're just, and there's nothing wrong with that, but I just want you to know that aging is another factor. Yes. So the longer you wait to have a baby, the more chances of you having troubles when
it's better you start early enough.
Yes.
Okay, but are there things that specifically women should do that could boost their reproductive and fertility? Let us hear about them.
Of course. First of all, like I said, age is the #1 factor. A second thing that you need to pay attention to, and this is just for both men and women, is your weight.
Your weight.
Yes. Sad to say, yes, weight.
Okay.
And not just overweight. If you're severely underweight as well, it would have an effect. But if you're obese, it decreases your chances of conception. So how do we fix that? Diet and exercise. Not by starving yourself, but by eating the right foods and always exercising. Exercising increases your blood flow, oxygenates your organs, just gets you ready for conception. Also, nutritional deficiencies. The Western diet these days, we're not eating properly anymore. You can see somebody can stop and buy donut from the fast food, or donut and Coke in the morning, or biscuit and Coke, and they'll say they've had breakfast. Lunch, they'll probably get a shawarma. Nothing against shawarmas, though. We're eating really unhealthy these days. We have a very unhealthy diet. So nutritional deficiencies. That's why you have to pop your vitamins to help us. Another thing that is very, very common now that people don't know is toxin exposure.
Okay.
Yes, we are exposed to so many environmental toxins these days in our plastics, in the household detergents, our soaps, perfumes. A lot of things around us that we use on a daily basis are very toxic to our health, and we need to know more about this stuff so that we can curb it. For example, I'm sure a lot of people microwave their foods, in their plastics in the microwave. Do you do that?
No, I don't.
Are you sure you don't?
Yes,
do
I
you
do
that?
Yes, I do.
You just come home, you bring your food from the freezer in the plastic, and then you just put it in the microwave. That is very dangerous to health, because plastics are made with chemicals that once you heat them up, the chemicals that they're used in making they melt and enter the food that you're going to eat. And that is, ingestion is the fastest way of getting toxins into your body. And the research shows that a lot of women that are going through infertility issues, and men, are exposed to a lot of toxins, as well as, you have to cut out other things like smoking, excessive drinking. If you cut out some, these are all things that we need to do to up our chances of conceiving, basically.
Okay, but is there anything that can, when one is infertile, can one be genetically infertile?
Can one be genetically infertile? I don't think that, I don't understand that question. There are medical conditions that would definitely, genetic. Yes, not genetic, but you have them. It's not like something you brought onto yourself. For example, fibroids, it's not like it's genetic, but the chances of you having a fibroid, if your mom had a fibroid, is high. Do you understand? So if my mom had fibroids, I would check, if her mom had fibroids, just like breast cancer, if your mom has you would check to see, because your chances are higher, but fibroid doesn't mean that you cannot get pregnant. Do you understand? It just means that you should watch it and take care of it to increase your chances of getting pregnant.
Okay, but how do you explain where a couple, has not been able to conceive for a very long time, and just from out of the blue, 10, 12 years later, they were able to have children?
Okay.
What happened in that particular scenario?
Okay, 9 out of 10 times,
yes.
Or 8 out of 10 times, people usually sought after advanced reproductive technologies such as IVF, IUI, and all those other things and sometimes they don't really try to discuss it. I don't know why, but you would see that as time goes on, you see a lady, maybe you got married at 25. You've been trying since you were 26. You've waited 10, 15 years, and at 40, you decide, look, it's time to do something else, something different. And they go and do IVF. Nothing wrong with that. It's perfectly okay. But where I have the problem is that most people don't tell you that that's what they did. Like there's nothing wrong with that. It's just, it's a means to an end, and I feel like most people don't talk about what they did to actually have the baby. So I think when you say 10, don't get me wrong, I believe that, sometimes, it can just happen naturally. But a lot of times, people actually sought after medical help to have a baby.
So why are people not talking about assisted reproductive,
I don't know, the society we live in, they kind of, it's just backward mentality, if you ask me. That's what I feel. I feel like it's out there for just like hypertension. If you had hypertension, you would go seek medical help. Or if you had to do surgery, you would do surgery. So what is the big deal in I just feel more people need to be more open about this stuff and remove the stigma. Just like a woman that has cesarean section, gives birth through cesarean, is almost frowned upon. I feel it's backward mentality, and I think our people need to get with the program.
Okay, I've had cases where ladies or couple will go see doctors, and after screening they tell them nothing is wrong with both of you, but yet conception is yet to happen, and they just tell them nothing is wrong. And also a case where I'm trying to, the best way to play this scenario, a case where they tell them to do, what's that test again a woman does? Is it HCG or something? I mean, now, I've heard people say that some women have to go through a lot because of fertility, unlike men. So when you're tackling with the issue of infertility in a woman, and they get to the stage where they say there is nothing wrong with you, and yet there's no conception. Well, I'm talking about the couple now, saying nothing is wrong with them and there's no conception. What can we say is medically wrong? Or what would we say? Would we say the hormones are not balanced enough? What exactly is wrong?
Like, it's different for everybody, When they tell you there's nothing wrong structurally, that may be like you have no fibroids, you don't have any PCOS, you don't have endometriosis. So you might either choose to play the waiting game, which most people decide, and there's nothing wrong with that. You live a healthy life, you cut out smoking, cut out drinking, take your vitamins, do what you're supposed to do, and just wait it out. Or if you're tired of waiting, you could still go ahead and do IVF. I'm not saying IVF is the all and all, but I'm saying if they tell you, if you don't want to keep waiting, it's an alternative, or it's a something that helps. You know?
Okay, let's take it back to, we had a doctor sometime last year who was talking about saying science has advanced to the point where every woman can have a child.
I truly believe so.
So that even if it has to do with you doing is it egg transplant or having a surrogate mother, and the last result is usually adoption. How aware would you say Nigerians are about this? I feel a lot of women still want to carry their own pregnancy, regardless the age. So how do we begin to let people understand the narrative? The science is advanced to the point where you can have your biological children, even if it's not the natural way.
I feel like screaming it. We need to stop with the stigma. You know, it's just a stigma. We need to stop with that thinking. You know, we need to be more advanced in our thinking and be more open-minded. Like you said, like science has made it so much easier. You know, now we have different options. There's IVF, there's IUI, or
What
you
is
can
IUI?
IUI is intrauterine insemination. So whereby we get your husband's sperm and then directly put it into the uterus for fertilization.
Okay.
While with IVF, the fertilized womb is outside, and then they put back the fertilized embryo into the woman. You know, so it makes it much easier. It's still your biological child. You're still going to carry the baby, and even if you don't, there are lots of women that, due to one reason or the other, maybe in their younger age, maybe from something like endometriosis, had to have a hysterectomy. And you
need to explain that.
It's like maybe like a removal of your womb. You know, a lot of people had to, you know, do that. But your ovaries are functioning, or something. Maybe you have fibroids all over, and these are causes that you didn't bring it upon yourself. So why is it so hard for people to accept that? You know, like you said, surrogacy. People in abroad or Bodoyibo, they've moved on. Like Gabrielle Union, Kim Kardashian. There's nothing wrong with her, but she just felt, you know, I want to have 2 more kids and I don't want to carry it. She has 2 extra kids through surrogacy. Gabrielle Union, Tyra Banks, a lot of people, even here, I think Nikki Oshinawa did that, and I think there's absolutely nothing wrong with it. I think more people should embrace.
Would you say the information surrounding this is not well has not been well disseminated? For instance, if you're saying that you have surrogacy, is that child still biological, carries your DNA?
It's still biologically your child. It's still biological, just that somebody else. It's almost like you're getting to a destination, but somebody's helping you to carry it. It's still your baby, 100%, you know?
But I hear legally that if you do surrogate, and then probably there's a contract you signed, and at the end of the journey, the surrogate mother tells you she doesn't want to release the child, is it legal to keep back the child?
No, it's not. It's not her baby.
All right. Let's talk Galaxy. Today we're looking at managing fertility both in men and in women, and we'll still have Dr. Nini Izoba. We'll take some of your comments after this quick break, as you're still here with us in the studio. We'll be right back. Don't move a muscle. Infertility. If you and your partner are struggling to have a baby, you're not alone. Infertility is defined as not being able to get pregnant despite having frequent unprotected sex for at least a year for most couples. Infertility may result from an issue with either you or your partner, or a combination of factors that interfere with pregnancy. Fortunately, there are many safe and effective therapies that significantly improve your chances of getting pregnant. Symptoms. The main symptoms of infertility is not getting pregnant. There may be no other obvious symptoms. Sometimes an infertile woman may have irregular or absent menstrual periods. Rarely, an infertile man may have some sign of hormonal problems, such as changes in hair growth or sexual function. Most couples will eventually conceive with or without treatment. Causes. All of the steps during ovulation and fertilization need to happen correctly in order to get pregnant. Sometimes the issues that cause infertility in couples are present at birth, and sometimes they develop later in life. Infertility causes can affect one or both partners in general. In about 1/3 of cases, there is an issue with the male. In about 1/3 of cases, there is an issue with the female. In the remaining cases, there are issues with both the male and female, or no cause can be identified. Causes of male infertility: abnormal sperm production or function due to undescended testicles, genetic defects, health problems such as diabetes or infections such as chlamydia, gonorrhea, mumps or HIV. Enlarged veins in the testes can also affect the quality of sperm. Problems with the delivery of sperm due to sexual problems such as premature ejaculation, certain genetic diseases such as cystic fibrosis, structural problems such as a blockage in the testicle, or damage or injury to the reproductive organs. Overexposure to certain environmental factors such as pesticides and other chemicals, and radiation. Cigarette smoking, alcohol, marijuana, or taking certain medications such as select antibiotics, antihypertensives, anabolic steroids, or others can also affect fertility. Frequent exposure to heat such as in saunas or hot tubs can raise the core body temperature and may affect sperm production. Causes of female infertility: ovulation disorders which affect the release of eggs from the ovaries. These include hormonal disorders such as polycystic ovary syndrome, hyperprolactinemia, a condition in which you have too much prolactin, the hormone that stimulates breast milk production, may also interfere with ovulation. Either too much thyroid hormone, hyperthyroidism, or too little hypothyroidism can affect the menstrual cycle or cause infertility. Other underlying causes may include excessive exercise, eating disorders, injury, or tumors. Welcome back. It's still Galaxy today, and Dr. Nina is still here with us. Let's take some of your questions as we round off this session. Please, is there any other solution to blocked tubes apart from IVF?
Well, yeah, with the blocked tubes, you could do a HSG. So it's a procedure you go to the to the hospital to do, and usually they pass a dye through it, and usually when you pass that dye, it helpfully opens up the tubes. But if it doesn't, most times it would open it up. But if not, I think IVF would help.
Okay.
Because you're bypassing using the fallopian tube.
Okay. Good morning, Doc. My name is Yemi. I'm having delays with a child of over 3 years. I have treated a yeast and fungal infection. What can I do again? I'm in my 40s.
She's having what? I didn't understand.
She says, okay, let me see if I can take that again. She says she's having delays, as in maybe she wants to conceive again after the first one, but she's not been able to do that, and she's had to treat yeast and some fungal infection, yet she's still not been able to conceive after the first one.
She might have to visit the doctor. I mean, most times when you have STIs, which is STIs, you might have, if it's not properly treated, it could progress to something called PID, which you might want to address immediately, because it could cause scarring in your tubes and cause a delay in conception. So that's something that you might want to address immediately. Go to the doctor.
Okay. Dr. Nini, thanks for your enlightenment on infertility, but I want to say that the alternatives in Nigeria are out of reach for over 80% of those in need, and there is no assistance anywhere. So how's the affordability when it comes to alternative and reproductive health?
Yeah, that's the only downside of it. It's not very cheap, it's expensive. But you have a lot of foundations now. I run a foundation called Dr. Nini Women's Health Awareness Foundation, and there's so many others. Ibiduni is doing an amazing job trying to give out like free IVFs to people and free treatments, and there's so many others. It's not cheap, but I know a lot of doctors, a lot of people that if you do the research, they have subsidized rates for people that are going through it. All they need to do is, look it up, find out somewhere that, or someone that is doing a program or something like that. But a lot of people do. I know it's not cheap. I know that, you know, we need to do more. They need to be, but it starts with the awareness first of all. People are not even talking about it. Talk less of people. Well, you see, when there's breast cancer, there's a lot of breast cancer walks. There's a lot of, you know, funding for all of that, as well as HIV. I feel like this is also a public health issue that needs to be dealt with, because the rates are getting higher and higher. More people need to, you know, create funding for it.
Let's see if we can take one more. Please, ma, I have abdominal pain during menstruation, short cycles, and irregular periods. Last month, I menstruated for 10 days. What could be the cause? Is that the symptoms of endometriosis, or could my irregular cycle lead to infertility?
Okay, unfortunately, as a doctor, I wouldn't be able to tell her what it is. Yes, her symptoms, you know, it seems like ovulation disorder or something, because she's not having regular periods. So it might have to do with her hormones. But I would advise her to see her OBGYN, not even just a doctor, her OBGYN. Yes, I'm a doctor, but there's some people that are specialized in dealing with stuff like this. So she should visit an OBGYN, and they'll be able to assess her properly.
Last before we let you go. I just had surgery for ectopic pregnancy. I lost my right fallopian tube. I'm 40 years old. Can I still get pregnant?
Yes, you can.
Okay,
you still have one more tube, so why not?
So you can.
Yes.
All right, doctor, thanks for being a part of the show.
Thank you so much
just
for
before we
having
let you
me.
go, I want you to reel out your social media and handles for people who may just want to follow you and interact more with you.
Sure. My social media is Ask Dr. Nini. That's AskDrNini. Ask Dr. Nini. So follow me there, and you can find me on YouTube, Instagram, Ask Dr. Nini.
All right, thank you. Our guest for the session has been Dr. Nini Izoba. She's a medical doctor. She's an enthusiast. She has several feathers to her cap, and she has joined us this morning to help people, you know, manage their health better, specifically when it has to do with fertility and infertility issues. Thank you so much, Doctor.
Thank you so much for having me. I appreciate it.
Thank you so much. I think the next time we'll bring you, but I have to tell us how to grow 6 packs for people like Justin.
All right, in a moment when we return, we have Dr. Coach Deji in the house. He will be talking to us about why men struggle in relationship with their children. In a moment, you don't want to miss this. It promises to be very interesting. We'll be right back. Don't move a muscle.